happy that you chose to spend an hour with us. And we are going to discuss something today, a subject today that is very important and rarely spoken to. And we thought today that we would elevate it to our elevate the visibility of this issue and see if we can make some inroads on this problem. I am joined today by my co-moderator colleagues, Dr. Ivan Walks and Dr. Jocelyn Hines. And without further ado, I will turn it over to Dr. Walks.
Thank you. Thank you, Dr. Neighbor-Stevens, and good afternoon, everyone. Thank you so much for being with us. We are going to discuss today, it's interesting, we always pull in an expert on our different topics and have someone who can lead the discussion. And it occurred to Dr. Neighbor-Stevens and I that between Dr. Neighbor-Stevens, Dr. Hines, and me, we know a little bit about the impact of alcoholism in our communities and can talk about that and open a conversation about that with all of our folks. Here's the issue. We hear a lot about the opioid crisis that's in the news. We hear a lot about violence, and that's in the news, a lot of the challenges in our communities. And one of them that maybe isn't as sexy or topical is the challenge of alcoholism, because alcohol hits us in many different ways. Certainly from Dr. Neighbor-Stevens as a pediatrician, it hits children hard with fetal alcohol syndrome, as well as other issues. Dr. Hines is a family practice doc, and I'm sure that as the things, all the different things that people bring in to a family practice doc's orbit, alcohol impacts many of them. And of course, as a psychiatrist, it's almost always in the spectrum of substance use issues that I have to deal with when I'm working with folks with mental health issues. A lot of self-medication around alcohol, a lot of alcohol being involved in people that maybe seek treatment for other drugs. They're dealing with challenges around benzos or challenges around opiates, and alcohol is a part of that. So we never really talk about alcohol as a gateway drug, but I'll just toss that out there because alcohol is such a prominent part of all of the other kinds of substance use issues that mental health folks deal with. I wanted to start by just kind of looking at some of the, everybody kind of drinks, right? Well, I don't, but a lot of people use alcohol, and people talk about being a social drinker. And sometimes I'll ask someone, well, do you use cigarettes or alcohol? And they will say, well, I drink alcohol rarely. So what does it mean when we see someone who's drinking? How would we know? What are the signs that someone is drinking a lot? I'm going to run through just a few of what those signs are that we can notice without having to ask the person, hey, are you getting drunk every night? Are you drinking until you black out? Are you drinking until you fall down? What's happening? Those are the kinds of things that we can sometimes see, but how would we observe maybe alcohol overuse in someone that we care about? One of the things that we would look for could be weight fluctuation. People talk about alcohol causing a lot of weight gain, but rapid weight gain or rapid weight loss, if someone's drinking and not eating, can be an issue. I'll often ask folks about their general health as part of a psychiatric assessment. I say, well, any health issues, and sometimes those issues can involve heart problems. A third area is mindset changes. People begin to experience anxiety, paranoia, some of the mental health consequences of overuse of alcohol. Sometimes folks are drinking all the time. And so you'll see that they will begin to avoid gatherings, places where they either can't drink as much as they normally do, or places where alcohol may be there and they can't control their drinking, so they'll avoid those kinds of gatherings. I'm going to run through these kind of quickly, but there's 12 of them that I want to run through. Another one is risky behavior. People talk about, well, how could you get in the car and drive after you've been drinking? Everybody knows you don't drink and drive. Well, we see risky behavior because one of the first things to go when you drink a lot is judgment, right? So people aren't able to make that sober decision not to drink after they've had a few drinks. Consuming a lot of alcohol puts a lot of strain on internal organs. So liver dysfunction, liver inflammation, pancreas, those kinds of things. Your internal organs can really be challenged to process a lot of alcohol. Sometimes people drink a lot when it's taken away. So I'm sure every doctor on this call has either had or heard of someone who comes into the hospital for something else, and they're in the hospital for a day or so, and you begin to see signs of alcohol withdrawal. They've never thought they had a problem because the alcohol has been there, but now the alcohol is suddenly gone and you see alcohol withdrawal. So that's one of the things you can look for when someone is actually overusing alcohol, but may not be talking about it or thinking they have a problem. One of the other ways that alcohol can impact the body is decreased ability to fight off illness. And so you'll find folks getting sick from other things because of the overuse of alcohol. And then you'll find sometimes people are drinking through problems. They don't seem to be dealing with problems that are impacting them. And so the alcohol use can be one way of them not addressing things. And you're looking at them going, wait a minute, why aren't you dealing with the fact that your rent is a month behind or 2 months behind and you're about to get put out of your home? Why aren't you dealing with the fact that you got a bad evaluation at work because you're not getting things done? But they're drinking as a way of kind of going through the problems. When people drink a lot, they tend to drink a lot. And if you see somebody drinking, 2 drinks, 3 drinks, 4 drinks, 5 drinks, 6 drinks, and they're still kind of able to navigate and do the things that you would think they couldn't do, then they may have an increased tolerance that may indicate that they've been drinking a lot. So I wanted to kind of just open it up with some of those things that we can look at. Those of us that may not be physicians or may not be nurse practitioners or other folks who will get to people and be able to make some more of a clinical assessment. These are things that we can look for and then begin maybe a conversation with someone about what may be going on that's making me see these other things, the weight fluctuations and all the other things that we talk about. So that's kind of an opening for us. I wanted to, let me toss it to Dr. Naybert Stevens, and maybe you can give us some impact, some things that you see from that pediatric perspective, whether it's folks who are drinking while pregnant, whether it's kids who are in an alcoholic environment. Go right ahead.
Well, thank you. But before I even go there, we both kind of violated a cardinal rule when you're talking about things, and that is to define it. And I just wanted to pause for a moment and define it so that we are all on the same page. Alcoholism is not taking 2 drinks a day, although it could be what is happening with someone who has the condition of alcoholism. The actual definition of alcoholism is the inability to control drinking due to both a physical and emotional dependence on alcohol. And a lot of times people use the lack of a clear understanding of the definition of alcoholism as part of their denial process and defense mechanism against acknowledging that a problem exists. So that's why I wanted to just back up a moment and define it. Now, to respond to what you asked me to respond to, I don't know, I may have said this once before, but I learned a long time ago that a sign that a pregnant woman or a newly delivered woman has an addiction is when I identify that they know their behavior and activity is detrimental to the baby and they can't stop it. Because I don't know of a stronger human instinct that exists beyond that of the mother's protectiveness of her fetus and her baby. So when I encounter pregnant women who are having a drink, now this may be in a social situation, for example, but if I see a pregnant woman having a drink, I'm not in my mind saying that she's an alcoholic, but it is a red flag to me that something is going on and needs to be further investigated, because it is pretty widely known that consumption of alcohol by a pregnant woman can harm the fetus. In fact, it is even discussed in the Bible. So this is not 20th century medicine we're talking about. This is the observation of the fact that imbibing of alcohol by the pregnant woman does create a danger for the fetus. So we do have a fancy name for a syndrome that was described many years ago called the fetal alcohol syndrome. But what it attempts to do is to organize a group of physical findings first that are observed in the newborn. And then we, later on, as the child gets older, usually identify intellectual and cognitive deficits as they go on. In other words, it affects the development of the brain. So this is a very serious condition, and it is more widely prevalent than, again, we really acknowledge and talk about, because the physical signs and symptoms, until they are older, the children are older, can be quite subtle. It's as subtle as a narrowing of this area of the lip and a thinning of the lips and a downward sloping of the eyes, which can be confused with the family characteristics. So it's subtle. In really, really severe instances, you become suspicious that something is developmentally off fairly early. In other situations, in milder cases, it can not be identified until closer to school age. But nevertheless, it is a significant issue for the fetus to be exposed to alcohol. And then children who are growing up in homes where the parents or there is a parent that is struggling with alcoholism, frequently are in situations where there is a lot of dysfunction in the family. There can be physical or emotional trauma experienced on the part, the physical and emotional damage can be perpetrated by the individual in the family that is struggling with alcoholism on any of the members in the family. And I'm sure you have heard countless stories of famous people who share with us the circumstances of their family life when they were growing up. I had a very poignant experience, and I'll end with this. When my kids were much, much younger, I was invited by their elementary school to come in and have a chat with the fourth graders about alcohol and drugs. Now, you may be wondering, why would they have me in to talk to a fourth grade class? And this was over 20 years ago. So this is not a new issue. And I talked with them in an age appropriate manner about alcohol and drug use. And then something told me, just ask these kids. So I asked the kids, how many of you are worried about your parents? And 2/3 of the hands in that classroom went up. And wow. I was just dumbfounded. So you never know what's going on, as my grandmother used to say, behind closed doors, but there's a lot of stuff going on behind closed doors. And with that, I'll turn it over to Dr. Hines.
So before you go, Dr. Hines, I just wanted to acknowledge that Dr. Lawson has been able to join us, and we're hoping to get some of Dr. Lawson's perspectives also. So if you'll stand by, Dr. Lawson, we can. I think Dr. Lawson is still on mute. So Dr. Hines, why don't you set the stage for us as a? Oh, there's Dr. Lawson. And there he goes, and he's back. Dr. Lawson, stop playing with your camera. That's the kind of stuff that I do. We can't have more than one person doing this stuff. Is it possible for us to unmute Dr. Lawson? Can you unmute, sir? I don't. So while Dr. Lawson is working on that, Dr. Hines, can we get some of your perspectives? This is certainly something that, as Dr. Neighbor Stevens alluded to, alcohol issues hit all parts of the family. So if you can give us some of your thoughts, please.
So I will just speak on two particular aspects of a very broad topic here. One of them is I used to do, over in my practice experience, I used to, in addition to being family medicine, so primary care for the entire family, I also did occupational medicine. So I would see workers who had been potentially referred by their employers for, strange behavior, alcohol use, that kind of thing. And in the context of talking, as Dr. Neighbor Stevens was saying before, about what does alcoholism look like, it's not necessarily the caricature of somebody falling down drunk, who can't keep a job, those kinds of things. Frequently, it is people who are still functioning, right? They may be having, troubles in some areas, maybe not. Maybe they haven't been discovered or found out yet, right? There are folks sneaking in the alcohol in their coffees and in their, soda cups and things like that. It doesn't necessarily come with this overt alcoholic sign from the outside. I remember in particular, I had a child who was being seen for behavioral issues at school. And the mom that came to support this child, who was previously doing well in another school, had switched to a new school. She had a lovely 7-Eleven cup that she was drinking right there in the visit, full of alcohol, whatever was mixed in there. And I remember thinking, this is this poor child's advocate, right? This person who is clearly intoxicated, who came, but who also still cared. Who still cared about her kid, right? But she's just clearly caught up, and so was this child, caught up in that, in a tough scenario. I would also just point out that for some people, their lack of, drinking too much is having an impact on their high blood pressure, on their heart disease. There are absolutely links between excessive alcohol use and blood pressure control, irregular heartbeats, liver disease, cancers even, not just the pancreatic cancers, but rectal cancers, colon cancers, mouth, throat, laryngeal cancers. So there are consequences all around for excessive drinking. And the other thing that I just have to slide in there before I stop talking is beer is alcohol too. There, for whatever reason, there are a lot of people who think that beer doesn't count or only hard liquor counts. But beer is alcohol, wine is alcohol, alcohol is alcohol.
Thank you, Dr. Hines. It's interesting that you're right. All of those things do have an alcohol content on them, beer and wine. And you may not need a lot of Bacardi 151 to feel it, and you may need a lot of beer, but beer will work. And I don't know, maybe that's why it comes in 12 packs. So because I know people that count how much beer they drink per day by the 12 pack. It's really very challenging. Dr. Lawson, we managed to get you unmuted, and really wanted to ask you to join the conversation today, and feel free to give us whatever part of this alcohol challenge in our community you have. I talked earlier about some of the signs that we can look for that someone may be overusing alcohol. Dr. Nabert Stevens went through a lot of the impacts on pregnancy, pediatrics. And then I think you were on when Dr. Hines was talking, but thank you for coming in and being one of those super smart folks that we asked to join the other super smart folks and give us a little bit of your expertise. So please.
Well, one of the points is that a lot of us been focusing on, quotes, hard drugs, marijuana availability, so forth and so on, and alcohol sort of fell off the radar screen. But in fact, it continues to be a major problem in our community for a lot of reasons. One is that it's been shown it's not people going out getting drunk or drinking substantial amounts for long periods of time. There's now good evidence that binge drinkers have as many complications and problems as the so-called chronic drinker. And that is the guy or the lady who goes out and really knocks it off over the weekend, or says, well, I only drank when I'm with my friends. How much do you drink? I don't know. I don't keep count. When we look at over time, the binge drinker has as many problems in terms of the physical consequences as a person who's a chronic drinker. Moreover, the binge drinker, because they don't develop that kind of tolerance, when they do get intoxicated, they have a lot of problems in terms of impulse control, in terms of driving, in terms of being able to just manage their life. Even though it's brief and it's dramatic, it also is extremely destructive. And the other point about this, so we recognize now, and I think you made an excellent point. One way marketing, the heavy drinker has gotten a bad name, but now a lot of people are getting alcohol through other ways. It used to be through cough syrup. Now they're getting through seltzers. They're getting it through hard cider, pears, and a whole bunch of other products. Usually, occasional drink, not a problem. But unfortunately, some folks really laid on with these and can have the same kind of consequences as having high concentration of alcohol drinks. And then what we're finding is that because of the coronavirus, people sitting home, nothing to do, or getting stressed out, or have chronic anxiety, people still use alcohol as an antidepressant or an anti-anxiety agent. The old story about the man says, well, my mother died last week, give me a fifth of scotch. We've changed the story a little bit. Now we go out and get some hard cider or something else. But again, the consequences are the same. Alcohol is a lousy antidepressant. It does not seem to have persistent, long antidepressant effects. It is sedating. It's a lousy antidepressant. Moreover, alcohol is metabolized fairly quickly, and as soon as it is removed from the body, the person can go into a much deeper depression. And the same issue in terms of using alcohol as an anti-anxiety agent. It's a terrible anti-anxiety agent. Again, it may create some transient relief, but as soon as it wears off, the person is in much more shape than it exists. I've seen folks that have panic attacks. The alcohol will stop that panic attack, but then in a very short period afterwards, the panic attacks are back worse than ever. Alcohol is a lousy sleep medication. A lot of people say, well, I can't sleep, I'm worried, go out, get intoxicated. Unfortunately, as soon as the alcohol is metabolized out of the body, which is given a couple of hours, what we find is that the catecholamines shoot up and a whole bunch of other neurotransmitters. Person can't sleep for the life of him. Then get into a vicious cycle, can't sleep, go out and get drunk some more. And then recently, and I did have to give credit to my recently deceased colleague, Carl Bell, who's a psychiatrist, who was noted when he was working in the correctional system that when he got a detailed history of some of the folks in the correctional system, he found that a lot of them, their mothers were drinking during pregnancy. And he has done an excellent job in terms of having people aware that alcohol during pregnancy not only produces the classic fetal alcohol syndrome with specific physiological changes and so forth in the body, but also, well, I hope we now recognize is there a syndrome, which may only have not much in the way of changes in the faces or the hands, but also brain changes that cause people to have difficulty in terms of executive functioning, which means in terms of making high-level decisions, impulse control, symptoms very similar to attentional deficit disorder. And what he made the connection, and there's some evidence that supports this, that a lot of folks in the correctional system who have had problems in terms of in and out of jail, in and out of juvenile hall, really have a variant of this fetal alcohol syndrome that started very early in life, and they literally cannot able to control explosive episodes of violence, good decision making because of that exposure, early exposure in pregnancy of their mothers to alcohol. And this is a very serious issue because simply locking up folks with a variant of fetal alcohol syndrome, it's not going to change their behavior much. They just learn how to become better. They may learn to become criminals rather than get help. This is an important public health problem that must be addressed. And it can be addressed. Folate acid in terms of pregnancy is one approach. And also, again, getting the message out. I was recently in California and was reading some of the contents of the wine bottles, and they said, they made a point, and I think every state should have a statement that drinking alcohol when you're expecting to be pregnant can have long-term consequences in terms of the fetus. And again, this is not heavy drinkers. These are not super drink. These are not folks that are chronic alcoholics. These are folks who are using alcohol episodically at a party and so forth, when they may have become pregnant and not be aware of it. So this is a public health issue that must be getting as much attention as folks watching out to make sure that they're eating fruits and vegetables, living good lifestyles. Make sure that alcohol is a natural product, but it is still a dangerous product, especially when you're taking it and as a possibility that you may become pregnant. And also, again, the marketing about this is now what we're seeing is that used to be African American women just didn't drink that much. That is changing, and part related to the larger culture, where more white women are drinking substantial amounts of alcohol. Again, we can look at this as women's rights. You can drink as much as men can drink, but the consequence we have to watch out for is the impact that it can have if the person happens to be pregnant. And as already stated, again, raising a child when you have an alcohol problem is a real challenge. And again, in our culture, because it's unacceptable for women to be drunk in public, if you will, unfortunately, many of them develop strategies to mask it or to hide it from their friends so that they can go about their life and still drink in a way that allows them to maintain high titers of alcohol in the blood. So we need to watch out not only for the long-term chronic effects of alcohol, but also the consequences of taking alcohol on a regular basis, even though it is not chronic, but episodically in terms of its effects. And then finally, we need to think about what does the alcohol do to a potentially developing fetus? And again, the long-term consequences, unfortunately, may not result in a person that has obvious developmental disabilities, but it could result in neurocognitive and impulse control changes that will be inconsistent in trying to manage oneself in a complex society.
So Dr. Lawson, thank you so much. You've raised so many good points and given us so much to think about. I wanted to just hit two things really quickly. One of them was you mentioned that there are all these other products now that have alcohol. There's hard lemonade, there's hard cider. And one of the reasons maybe I didn't drink back when I had a chance to really drink with my friends in high school is that I just thought it tasted bad. Everything they were telling me to drink just tasted bad. And so when we're talking about young people now, young people have all of these things that I've never tasted them, but what I keep hearing is that they don't taste bad. And so it's easier now to pour, to put back some hard lemonade or hard cider. Have you noticed that is a way of attracting younger people to drink now?
Absolutely. And the message that a lot of folks don't use certain drugs because they taste bad, they taste like medication. So this is bad. But many young people are now learning that, you can taste good tasting stuff. And if it's good tasting, it must be safe. Right. When in fact, we know otherwise. And go back to the cereal industry. Cornflakes and other products weren't selling very well. They added sugar to it. The sales went through the roof. The same thing we're finding in terms of alcohol. Folks, many young people are just not going to go out there and buy a bottle of scotch. They just aren't. Even drinking beer is a challenge for many women. No problem at all. We'll make it so it tastes just like your usual berry drink. Tastes just like your Gatorade. It tastes just like all your other healthy, fruity products. And it sort of gives the illusion that you're drinking something that is healthy, safe, and won't really do much to you in terms of your brain processes and thinking.
Yeah, thank you, Dr. Lawson. That's very helpful. I wanted to see if we can switch a little bit in terms of the focus. We've talked a lot about what it looks like when people drink and why people drink. One of the challenges is that we can look at other people and say, you shouldn't drink, and it's bad for you, and it's hurting every part of your body. It's hurting your mental health. It's hurting all of these things. And the other part, though, is that when people do have something they're challenged with, alcohol is never too busy for you. It never tells you it's busy with somebody else. It never tells you, well, I got a new girlfriend, or, we can't hang out. Alcohol is available. And you mentioned, Dr. Lawson, the short term alcohol will make you feel better, but long term, it makes everything worse. But you know what? Sometimes when life is just bad, I just got fired, I did lose somebody, I need something right now. and alcohol is not too busy for me to get some. So this issue of telling people to just not drink, I think, is challenging. That whole just say no thing that people tried to do decades ago doesn't really work. And so some of the treatment, what is it, Dr. Hines, in your family practice background, you know everything that I just said. So what is it that you try to connect with folks on to get them to say, you know what, despite the fact that while I'm drinking, I'm feeling great? How do you get folks to recognize that they need to do something else? Or how do family members get folks to recognize they should do something else?
Well, one of the things that oftentimes I would try to connect with people who I was trying to get them to stop drinking, for example, is identify the places that were, because in the definition, we were talking about emotional addiction too, right? Well, so what are the things in your life that matter to you that are being impacted? And oftentimes there were stories, people did have instances where they see that their kids treat them a little bit differently, or they keep getting into fights with their parents or their spouse or whatever over drinking. So lots of times there are relational things where people can connect with that are like, I do wish that I could stop having this argument or stop dealing with, this thing. And for the folks that are having, using alcohol for emotional things. And again, I would oftentimes admit that alcohol is just your particular drug of choice. For some people, it's food. For some people, it's cigarettes, right? Like lots of people have a drug of choice for their emotional stuff. But the reality is maybe let's try to deal with the emotional stuff, right? And then just try to acknowledge that what you're trying to hide hasn't quite gone away. So we have two choices, right? Like either keep drinking so that we never, ever feel it, or maybe try to deal with whatever the underlying issues are. As you all have heard from me many times, let's get to the heart of the issue if we can, right? Because some people have some legitimate things that they don't want to think about. And I wouldn't want to think about those things either. But hopefully, if there's something else in their life that matters to them, if we can find the other thing that matters to them, and that can be the starting point for, making moves towards positive changes. I'll also say too, drink alcohol also has a very social acceptance component to it. So there are lots of times where people are in situations where they might want to stop drinking, but to feel a part of their group, to feel a part of their social circle, to feel a part of the work happy hours, the sales meetings, the whatever, there is this pressure to drink. And they don't want to be that grown person drinking a Shirley Temple or just having the water. It can have professional impacts and things like that too when you're not part of the crowd. So there are some legitimate struggles that people have to deal with.
Dr. Walks and Dr. Lawson, I want to pitch a ball to the two of you. Not that I expect you to be able to solve this, but at least let's open up the conversation, because as Dr. Hines just said, let's get to the heart of the matter. So we have on numerous occasions identified the fact that our society and the Black community in particular is under extreme stress and duress, and it's not getting any better. Inflation, I went to the store yesterday. I couldn't believe it. Economic stress, political stress, the traumas from racism, the list is endless of the assaults that are afflicting our community at this time. But I want to raise the ugly truth. If you make the decision that you want to seek help, if you get the answer to your phone call, the appointment may be 6 months or more out. What can we do? What can the average person do who acknowledges that they have a problem and need help? What are we to do? There are not enough mental health workers at any level, what can we do?
Dr.
Well,
Lawson, I'll let you go first.
yeah, one of the good news is that for alcohol use, at least, we found that the primary care provider or even a non-physician nurse or psychologist can often stop or treat effectively the person who's a binge drinker or who is low-level alcohol dependence, just by going out and explaining to them the consequences of drinking. We have the techniques such as motivational type therapies to explain people these findings. And what we find is that you can actually get a person to, if not cease drinking, develop more healthy drinking habits about 50% of the time. So that's the good news. We can make interventions. Unfortunately, as you said, we have so many other messages. If you want to be a real man, you can go out and hold your liquor. So many other messages that encourage people not to listen to that advice. But being given advice by a respected authority figure is very effective in terms of improving and bringing alcohol intake under control. The other point is that we now have medications such as variants of long-acting naltrexone that can literally block or stop the craving for alcohol, in which one person gets the injection once a month, and the drinking can be greatly cease. So we now have technology, we have evidence that doing something, even if it's giving information, showing some charts, showing some liver with cirrhosis, so in a kid with brain damage, can be very effective in terms of changing the trajectory and preventing heavy alcohol use in the future.
Thank you, Dr. Lawson. All of that is really good information. You're right. The Vivitrol injections, the taking naltrexone daily, and those medications, as Dr. Lawson alluded to, don't have to be prescribed by alcohol treatment person or a mental health treatment person. They can be prescribed by your primary care practitioner, whether it's your physician, your nurse practitioner, what have you. And so a lot of times people don't know that there's that kind of help. And what they get is this message to just stop drinking. Let me quickly address what Dr. Neighbor Stevens said, and then I think there's something in the chat that we need to get to. But the response to your question, Dr. Neighbor Stevens, is there's a myth that we can't do things because they cost a lot. We don't even investigate. There are alcohol treatment centers that will accept your health insurance, and they typically don't have a long waiting list because they're businesses. And if you have money, they will let you come in. And if you have insurance, they will check your insurance and see if the insurance will cover you coming into those centers for treatment. And you can have inpatient treatment where you go into a facility. They help you safely stop drinking, because if you suddenly stop drinking, you've been drinking. I had somebody say, well, I don't drink that much. I just drink a fifth of vodka every night. A fifth of vodka every night is a lot of drink to consume, right? And if that person were to stop drinking right away, it could have tremendous consequences. Folks can stop drinking suddenly and have seizures. Folks can die if they stop drinking alone by themselves. So these facilities can bring you in, safely help you to detox, and then begin to help you develop the skills to not drink. And they can also begin to give you that Vivitrol shot that Dr. Lawson mentioned. They can start you on the naltrexone. They can do things that can help you. Now, going to your primary care doctor and saying, hey, I need a prescription for naltrexone. They can give it to you. Are you going to react to it? in a way that's positive and helpful. So you need to make sure somebody is paying attention to whatever medicine you take. And though the last comment I'll make on this is, oh, wait a minute, in addition to the inpatient treatment, a lot of those places also have outpatient programs, and they're different levels. There's a partial hospitalization program type where you're there every day for a certain number of hours. There is intensive outpatient where you may be there a couple of times a week for a couple of hours. And then there's like general outpatient where you go in periodically to get support and encouragement. And what's common about all of those types of interventions is that they have counseling and people helping you build the skills and develop the habits so that you can not drink and therefore avoid all the things that we talked about and Dr. Hines talked about, those everything from messing up your internal organs to cancer. So it's important that we don't assume that because, well, I just have a job at the post office, or I just have a job in the federal government, I don't make a tremendous amount of money. If you have insurance, it's potentially an option for you to go into a program and get a significant amount of help targeted at your treatment, not just you're just gonna stop drinking, go home and stop. It's bad for you. There's a lot more available than that.
Let me mention one other, Dr. Wilkes. That is that there is a widely known support program for alcohol use and abuse, Alcoholics Anonymous. The dirty little secret is that if you look at the participation of Alcoholics Anonymous, which can be a very excellent support program of folks who are undecided about whether or not they want to get into treatment or not, is that it is underrepresented in terms of the African American community. There are some groups that are targeting African Americans, but unfortunately, historically, they have many of the groups, yes, were not very receptive to people of color joining or the women joining. And as a result, that kind of support system wasn't available. But we must do more to make Alcoholics Anonymous available to our community. And some of the more effective ones have been programs that's been developed in our churches. One was developed as part of a barbershop. Others have been developed in terms of beauty parlors. So having an Alcoholics Anonymous program tied in with community organizations is a very effective way of laying the foundation for people who are either on the fence about getting treatment or staying in treatment once they started. And also one program that's really underutilized is Al-Anon, which is a program for family members who has a member with alcoholism. Again, alcohol is often an issue involving families, and the families unfortunately develop tendency to actually begin to reinforce and supporting alcohol use because the person is nicer when he's drinking, or because the kids can get away with more stuff. And so having the family being involved can be a very effective way to begin to get someone to stop using, and not just the family in terms of a large extended family, but also in terms of couples. Often one couple may be a drinker, but the other one is not, and they don't have a clue as to what to do. And they can often get support from an organization like Al-Anon. And unfortunately, Al-Anon programs are grossly underrepresented in the African American community.
Just to follow up on that quickly, Dr. Lawson, some churches that I know of, African American churches, have a program called Celebrate Recovery that can also give you that support to so that you're not out there by yourself. One thing really quick that's in the chat. There are two things in the chat. The one is sort of in the middle of what we're talking about now, so I'll take that one first, then we can go back up to the other one. The comment in the chat is, isn't the need to alter our mood on a daily basis the real issue, switching to another drug is not a solution to the problem. Treating alcoholism or drug addiction without counseling is really not going to solve the problem. I couldn't agree more with the last part of that sentence, that just that trying to do this without counseling is very, very challenging. I think that there's something that that Dr. Lawson can probably talk more about called medication-assisted treatment, where medication is a part of the treatment. And it's not the same thing as we're going to replace one drug with another. It's not that. And so maybe Dr. Lawson, could you mention a little bit about medication-assisted treatment and how it may be useful for someone who is trying to stop using alcohol or other drugs? And then I do want us to get back to the other question about hereditary type things. And well, Dr. Hines, you want to jump in first?
Yeah, and while you're, Dr. Lawson, while you're addressing that question, can you also speak to the fact that abstinence is not everybody's objective?
Yeah, I mean, first thing, point is that abstinence used to be the goal, especially for AA and other groups, but it was now demonstrated over and over again that you can get to the point in terms of effective treatment programs and using targeted counseling where people don't have to be abstinent. So it is possible for many people to go to a point where they can drink relatively safely and without being abstinent. So that was old AA concept. We're now recognizing that does not have to be true. But at the same time, it's in the back of your mind. Remember again the risk for fetal alcohol syndrome. So there is an argument, especially for women who had risk for becoming pregnant, not to be drinking at all. But abstinence does not have to be the target. People can learn, given the appropriate support and counseling, to drink safely. And most people do. So it's a subgroup of people who get in trouble. The other point is that we're not talking about opiate drug use and other drugs in terms of medication-assisted therapy. What we recognize is that you can block the craving for alcohol, not by substituting another drug for alcohol, but we found that alcohol use is tied into the endogenous in the endorphins. These are the pilot molecules in your brain that are used to generate pleasure and pain that's related to why we eat and drink and derive pleasure from eating, drinking, have sex, and so forth. And what we found is that if you block these endorphins, you block the craving for alcohol. And that's what medication-assisted therapy does. Agents such as naltrexone, they are opiate blockers, but you're not blocking the use of morphine or heroin. You're blocking the opiate molecules that are normally occur in your brain that determine where you get pleasure or not. And what we found is that if you block them, it's much, much easier, especially involved with counseling program, obviously. It's much less easier to get people to begin to reduce or to actually stop drinking in a way that's hazardous.
Thank you very much, Dr. Lawson. There is a question in the chat that I'm just going to read the question and then ask Dr. Lawson if you can react to this. First of all, I want to say thank you because the question starts with a happy, blessed Sunday, everyone. And then the question is, the comment is, don't forget hereditary. My father was a functional alcoholic, skipped his children, but there was concern for one of his grandchildren. The question doesn't get into what the concern was about, but we often hear people talk about alcoholism runs in my family, or there's one of my parents was an alcoholic, and so I'm at higher risk. Can you address a little bit about that?
What we know now is that alcohol use does in fact have a genetic component. For some folks, the risk of alcohol probably the same way as risk is with diabetes. Is not a single gene disorder. It's a polygenetic disorder that does not carry along with one generation to the other, can skip generations and so forth. And what we recognize now is probably multiple genes that's involved, clearly interacts with environment. So what we find is that there are some people who probably have who can expose to all kinds of stresses and all kinds of things, and they'll never drink. On the other hand, we'll find that other folks don't need much at all. They have their first, and says some people with strong evidence of alcohol dependence, they'll tell you in detail the time, the hour that they had their first drink. And then for them, it's off to the races. We also found that there are population differences. The enzyme that is one of the enzymes that's associated with alcohol in some populations is not there. And so as a result, you find, especially for people with some Asian ancestry, that they'll develop get sick whenever they get too much alcohol. And there's one of the phenomena I always noticed was why when you go to sushi places, they give you little bitty cups. And it's because many folks, the Asian population can't have heavy loading of alcohol. On the other hand, it's modified in Native Americans so that you have very high rates of alcohol use. So there are real population statistics about that. African Americans has a modification of that, so that actually African Americans tend to be less likely to develop alcohol dependence. It's not absolute at all. And in fact, right, we can override all of these very easily. But the bottom is, yes, it can travel in families, but yes, environment can make a big difference. And you go to countries that do not allow alcohol. The interesting thing you find is that alcoholism rates are pretty much the same, even though there is no alcohol available. And so there is a genetic component that can contribute, but it can be overridden, and it does, and you can treat folks very effectively. Now, does that mean that if you have family members of alcohol, you're going to be an alcoholic? No. But what it does mean is that you want to have a cautionary note, especially if the person is having problem drinking, in terms of intervening early to try to let them know that you got a problem and you need to do something about it.
Thank you very much, Dr. Lawson. I think we've had a very great discussion to this point, and I think we're about ready to wrap up. Is that fair to say, Dr. Neighbor-Stevens?
I think so. I don't see any additional questions. There's a comment from Dr. Gibson. But I think the message that I hope we have been successful in delivering is that be aware that this is still an issue. It didn't disappear with the opioid epidemic or with COVID. It's still very much with us, but there are things that you can do to control it. And that's the message that we need to really share so that people don't feel hopeless.
Thank you, Dr. Neighbor-Stevens. Dr. Hines, any final comments from you, ma'am?
I would just say, to kind of Dr. Neighbor-Stevens' point from her story earlier, if you have concern about someone, a friend or a family member's drinking, talk to them about it, ask them about it, let them know that you're concerned about their drinking. to me, it's not as important to label the person to say, hey, you're an alcoholic, right? As it is to say, hey, I care about you and I'm seeing some things that are concerning. Or if you're the person who is evaluating their own relationships and are like, I have tried to cut back, but just couldn't make it to that 1 week mark like I thought I could, or whatever. Or, I am tired of fighting with my, spouse or my roommate about alcohol related activities. Sometimes it's not even the drinking itself. It's the stuff you do while drinking, right? It's your personality, your attitude, the mess you leave in the morning, all that kind of stuff. Because as Dr. Lawson pointed out, there are lots of ways to get help. It doesn't necessarily look one way, but.
Thank you very much, Dr. Hines. I see Dr. Ernie Smith has his hand up, and I don't know if it's possible for us to unmute Dr. Smith quickly. I would like, there we go. Please, sir, go ahead.
I raised my hand because I saw Dr. Wilbur Jordan's hand go up and you didn't call on him. So that's why I raised my hand, because he probably doesn't know how to use that app.
I think, every time I talk, Dr. Jordan always does this to get me to shut up.
Oh,
So that's what I thought was going on. Dr. Jordan, did you have a comment? Thank you. Thank you, Dr. Smith. We can't hear you yet, sir. Dr. Jordan.
He's on mute.
You're on mute, and sometimes it's hard for folks to get unmuted.
Oh, here you go. Can you hear me now?
Okay. Yes, sir.
Okay. What I was trying to say, we have to appreciate there's a class differences and everybody isn't the same. My stepfather was a bootlegger in Little Rock, big bootlegger. I'm gonna sound very arrogant. I had never met people like that. They were a whole different class of poor folks who were drunk, who did everything, etc. I didn't know these people existed. I mean, they like, my whole world, I was totally uncomfortable. So when I finished my residency, I went back and worked in Pine Bluff trying to work with some of those persons. It's a whole different thing. And I just want us to understand, if we're gonna try to get people to stop drinking, it really needs to be an effort. We need it. This is one place where churches and other groups can get involved, because depending on the particular circumstances, it's a lifetime. Now, I was in Little Rock year before last at the family home, and I found 4 big gallons of moonshine. He's been dead for 20 years, but he still had some buried. So I took it to the ATM just to see, and they ran the test on it. It was 220 proof. But the guy came out here, turned white. He said, "This stuff is testing 220 proof." I said, "I thought you divided by." He said, "Yeah, that means there's 110% alcohol." I said, okay.
Okay, Dr. Jordan, I don't know how you get 110% alcohol.
When they drink moonshine.
Okay.
I mean,
well,
I don't
Dr.
know how
Jordan,
they deal with it, because it's some strong stuff.
It is some strong stuff, and I think the most important part of that story is that you didn't drink it.
Oh no, I don't drink nothing.
Okay, all right, good. We're happy. We're happy about that.
No,
Dr. Jordan,
Coke, the only thing I'm going to drink.
Okay. Every time you come on, you give us something that we can chew on. Thank you, sir. Dr. Lawson, did you have a final comment before we sign off?
Yeah, I just want to note, Dr. Jordan, I'm from rural Virginia. We had that same old moonshine too. But it's very much part of the culture. But I want to again emphasize this, that one, in terms of if you're expecting, don't drink. When you do work in correctional systems, consider the possibility that the person may have a fetal alcohol syndrome. So they're not going to respond to treatment as they used to do. And it's not just chronic drinking. Again, impulse drinking or is just as bad as chronic drinking in terms of the long-term effects.
Thank you, Dr. Lawson. I wanted to go ahead and wrap us up. And in the middle of doing that, my final comment, I want to look at something that Dr. Gibson had put in the chat about folks with two things: folks with pre-existing health conditions that use alcohol. Alcohol is bad for a lot of things that we do. There's a comment about healthy drinking. Well, you got to be healthy to do healthy drinking. If you're already sick and have other health problems, you really can't do healthy drinking. So there's something about understanding what your health issues are before you decide to pour alcohol on those things. And in addition to that, you know, there's a belief sometimes that whatever's going on, if I can just get to the doctor and I can get the right medication, it's going to be okay, because a pill will fix it. I tell, very few times do I use absolutes, but I use absolutes with my patients. I tell them, I say, anytime, any doctor ever prescribes any medication for you, for anything, look it up, read about the medication. Go to RxList, drugs.com, the NIH site, Mayo Clinic, all those credible places, and understand what that medication is about. And I'll talk a lot more about that some other time. But the key to what was in the chat is, if you're going to pour alcohol on top of your prescriptions, most of the time don't. And if you do either binge drink on the weekends, like Dr. Lawson was talking about, get some help for that because it's serious. But even if you just drink a few drinks at night, ask your doctor, can I consume alcohol when I take this medication? Read about whether you can. There's a lot of information on those credible websites about alcohol and prescription. So, and you know, you can always ask the pharmacist too. There are a lot of people that understand about this interaction with the normal stuff that we do and the medication that is prescribed. Just one of those things is using alcohol when you have prescription drugs. So I want to thank Dr. Gibson for putting that into the chat. And with that, hearing no objections, moved and carried, we are going to close up this week's edition of the Black Health Trust. Thank everyone so much for coming and being a part of it, sharing this with us. A special thanks goes out to Dr. Lawson for joining us this afternoon. Goodbye, everyone.
Bye. See you next week.